Waldrum has joined us here live in the studio this morning amidst all this controversy lawsuit that is now going on. And you'll have an opportunity to hear from the horse's mouth kind of what's going on. And I know, Dr. Waldrum, first of all, thank you for coming in. It's good to see you. It's been an interesting week for you. You had a press conference yesterday. And I know that, there are going to probably be some things because of litigation you can't say. But obviously, we wanted to have you in and try to get your perspective on this. People want to know what's going on. So thank you for your willingness to come in.
Appreciate the opportunity.
So let's start with why did the board, why did your board and the county commissioners feel it necessary to take away the appointments to the upcoming appointments to the board from the UNC Board of Governors?
Well, I think that there's, like any complex decision, there's no real simple answer. But the fact of the matter is that our board is always looking at a rapidly changing and difficult healthcare environment and what's the best thing to do for that company. And so we're a separate private 501(c) with a board, and they look at a lot of issues. And we have two of our members that go to the Governance Institute and study governance. And so historically, for years, they've looked at what's the best governance structure. And I think everyone agrees that what's called a self-perpetuating model is the best governance model. And so that's what they proposed. It makes sense because who knows best for what Eastern North Carolina needs or Vidant Health needs than the board of that company, and having a group that lives in other parts of the state kind of dictating to us who our board members are, doesn't really make sense if you think about it. And so that's really the underlying premise. And so as we look at the future and the things that we saw coming, the best people to look at what are the needs here in Eastern North Carolina for all of Eastern North Carolina is our board.
So it's being positioned now that Vidant wanted, you want to disassociate yourself from the medical school and those kind of things. That was never any underlying feeling. There's no agenda to try to disassociate Vidant with ECU and the Brody School of Medicine.
Yeah, there's so many false narratives out there, and it's unfortunate that that's the case. But if you think about, what we know now versus what we know when we were making the decisions, is always interesting because, but the fact that in the transfer agreement, so this gets complicated, in the transfer agreement, board changes require a couple of things. The two parties of the transfer agreement have to agree on those changes, and that's Pitt County Commissioners and Vidant Medical Center Board. And then Vidant Medical Center Board is made up of a number of different folks, including people that work in ECU.
Yeah.
And also the Board of Governor appointees. And if you look at the technicalities of making this change, the people that created that many years ago said, well, if you want to make governance changes, you need at least 85% of the UNC designated board seats to make this change. And so this was done very deliberately over a number of meetings, and it wasn't 85%. It was 100% of all of those groups.
So these are the people who, including the people who the UNC Board of Governors appointed to your board, they agreed that this change in governance should be made.
It includes faculty members of ECU, Brody School of Medicine.
So it wasn't just your decision?
No, it was we looked at the issues and deliberated it. And so if you understand that those people have looked at the issues and understand the complexity of those issues and made the best decision for our 501(c) company and did it per protocol. So, that idea, and then importantly, just on the very face of it, when we were looking at this, we self-imposed having two ECU leaders be on our board. So which is my boss, the board is my boss. So if we were trying to dissociate ourselves with the Brody School of Medicine or ECU, why would we have voluntarily put two ECU leaders on our board. And so, the thought is, and we all know this in Greenville, right? We need ECU and Vidant working closely together. The best way to do that is integrate leadership and governance between the two institutions. Having, let's say, the chancellor or the dean be on our board, which is my boss. And when we're talking about putting funding in and doing things to help Eastern North Carolina, that they are in our boardroom helping make those decisions is the right thing to do, and is a very significant show that in no way was this to pull apart from UNC or ECU or the Brody School of Medicine.
So there's been a tremendous amount of consternation between the UNC system and ECU, UNC system in Greenville the last few years. I want to get into that and get your opinion of what role all this is playing in your decisions and their decision. But now they filed a lawsuit. UNC system has filed a lawsuit. They filed it on behalf of ECU. As I mentioned several times on the show, we confirmed that no ECU trustee was informed. And we got a message when I said that on the air this week. We got a message from Chapel Hill saying, "You got that wrong. ECU was fully aware of the lawsuit." I went back and confirmed that no trustee had any knowledge that there was going to be a lawsuit filed. So to say that ECU was fully informed would be inaccurate. Someone at ECU might have been informed, but the ECU was, I don't think you could say ECU is fully informed if their board of trustees doesn't know it. So this lawsuit's filed on behalf of the university and the university system against Vidant Health. It's filed in Orange County. You went to a hearing over there, I guess, last week. And now, as I understand it from your press conference yesterday, you mentioned that everyone has agreed to have this move to Pitt County, and there's going to be a mediation, which, of course, for people who don't know what that means, it means that you're going to get people together and try to work it out without going to court. But if you can't work it out, you could still go to court. Is everything I just said just accurate?
Well, I can't comment about the Board of Trustees and
Right.
who knew what then, but I can comment about the latter part, which is the proceedings. And I think it's important to note that we offered and had met with the other side and had agreed that we wouldn't move forward with appointing those two open seats. Because our intention, when we made these decisions, we thought that the Board of Governors was going to follow the contract that we have with them, and they were going to already appoint those seats. So we did not, and so we've clearly communicated that our intent has never been to poke them in the eye on that issue. So we had already agreed to that, and so we've agreed that we will hold off on moving forward. And they've agreed to move it to Pitt County, and we were both staying our issues while we mediate. And that's why it's a bit surprising that somebody is lobbying our senators and legislators to advocate cuts to the largest safety net provider that also has a $70 million integration with the Brody School of Medicine. That they've decided that they already know the outcome of that process, and that that makes sense. And so it's a bit surprising that that's happening, given that the affiliation agreement that we have with them is intact. That if those cuts go in effect based on logic that we don't agree with, that it will hurt us and hurt Brody School of Medicine, because as everyone in Greenville knows, we're highly connected. And so to be the judge, juror, and executioner when the legal teams on the same day agreed for a process to mediate our issues. And, we feel like that UNC and Brody School of Medicine has significant issues that we need to sit at a table and hear and discuss. And we do too, because we think that the historical underfunding and undersupport for Eastern North Carolina in care delivery and the Brody School of Medicine and ECU needs to be dealt with. And so we want to have that conversation. And we think it's time to have that conversation.
So just to clarify and to see if I understand what you're saying, your position is that this thing is on the road to mediation. You have you've agreed to sit down and try to work this out, and then out of the blue, I guess it was Tuesday, we learned that the Senate is going to strip $35 million in funding away from Vidant. And if I understand what you just said correctly, you believe that someone has lobbied the Senate to do that.
Well, we didn't ask them to do it. So
I'm sure you did.
I mean, I don't know. I don't know.
Yeah.
I mean, I don't know.
It appears that way.
Well, did they just sit in a room and dream it up, or what's the logic around doing that?
So all of a sudden, the legislature is involved in what is a dispute between Vidant Health and the UNC system,
between a private company and UNC system that still has an affiliation agreement with the entity, and has a path to resolve those issues. And if you look at the contract that we have with them, there is a year cure period, even if you think there's a breach.
Right.
So the idea that this scorched earth type activity, that somebody knows more than our board, the Pitt County commissioners, our lawyers, and that they've just decided they know the outcome, to me is just another sign of the way we're treated in Eastern North Carolina, without respect of the local people that understand their issues. And, it's one of the great things we all love about Eastern North Carolina. We're talking about neighbors and people that work. And so our board and the Pitt County commissioners literally, they go to the same churches, they live together, they talk about these issues. We all know the reality here. And this kind of disruptive external factor disrupting those relationships, not dissimilar to what you described earlier, just tears our community apart. And I think it's wrong, because we need to recruit physicians. The Brody School of Medicine does an awesome job. You've heard me say that repetitively. It is one of the top value medical schools for producing primary care physicians for rural environments. We think it's a very important thing and asset, and does a great job. And so we want tighter integration. We want it to be supported. We want incremental growth in the medical student classes in the two campuses to be the same for both campuses. We want the faculty to be paid the same as the other faculty of the state's institution, because Greenville deserves that support. And our board understands those issues. And so we want to talk about how we build a system that includes Eastern North Carolina.
I don't know if you're going to answer this, but I'm going to ask it anyway. I mean, deal with the elephant in the room. I sat on the UNC Board of Governors for 4 years. There were some significant, and when I say significant, I mean like ongoing conflicting points of view on UNC Hospital moving into Eastern North Carolina. They came in and they did an affiliation agreement with Rocky Mount. They came in and did an affiliation agreement with Kinston. As you know, I was heavily involved in trying to keep that from happening. I thought that was too close to Greenville, and I thought, this looks too much like an overall plan to move UNC healthcare around Vidant and choke off the patient access to the feeder system to Vidant. Then you have UNC hospitals trying to make a deal in Charlotte with Carolinas Regional no one knew about. And when it hit the light of day and hit the media, it was shut down immediately. So, and I said this earlier, I think that, UNC hospitals, they wake up every morning and think about Duke. We got to get bigger because Duke's getting bigger and we got to compete with Duke. And so all of a sudden, we got all this consternation now and conflict going between Vidant and UNC hospitals. Do you believe that there is a bigger plan in place here, that UNC hospitals want to come in and take over Vidant Medical Center and Vidant Health?
Yes.
You do believe that?
Yeah, I think that they've made it very clear.
So you think this is part of that?
I think that you look at the facts that you described and other facts that we know that there is, and the things that have been told to us by them.
Yeah.
That yes, there's an expressed intent, and I think that that's the issue. And so,
does it feel like a hostile takeover in the works here to you?
Well, you described a lot of historical activities that
Yeah.
from the outside don't make sense to me. I've verbalized this before, so it's not new information, and I get attacked for having my opinion. But, I don't know how it helps the state and how it helps resource allocation for some of the things that you described happening to happen. And, just recently, it's just another example of it, is that we have a great transport system that's really awesome, and we have, really unbelievable care and teams that are built up. The fabric of our care is built up by the Brody School of Medicine faculty, community physicians, and Vidant Medical Group. And so it's a different model, but it has its strengths, and it's a really beautiful and good thing because, we have top-notch cancer services, neurosciences. I could go on. And it's by collaboration, by design. And that's actually how doctors work in the real world after they get out of medical school. And UNC has a different model, and UNC is a very great system, and it's a fabulous place, and I have a huge amount of respect for Dr. Roper and what he's built and done. However, the fact that, for instance, in the last year, that a $5 million helicopter with a UNC logo is parked right next to one that we've had there for many years in a community in eastern North Carolina.
Where's that?
In Jacksonville.
In Jacksonville.
Is done with intent, right? You don't put $5 million on a tarmac and that you can direct and take patients.
So they want these patients to go to UNC Hospital, not to Vidant Health, but not to Vidant Medical Center. That's what it appears. Yeah.
Yeah, I'm sure they do.
Yeah.
Yeah, of course they do, right? And so if you're looking at how you build a system that, it's coordination, right? And so you wouldn't expend assets that way. Mm-hmm. And we think that, these kind of actions are done to, and it's not just us. Every time one of those events happens that you described, I get emails from faculty members at the Brody School of Medicine and say, what is Vidant going to do because UNC is in our market hurting us, right? And so that's Brody. I get those emails, and other administrators do too, because they see that, and they're here trying to take care of Eastern North Carolina, and they don't understand that, right? Mm-hmm. And so we don't understand undermining us when we've been, and I've always said not enough, right? Mm-hmm. Historically tried to support, if you look at it from a benchmark perspective, we're about the middle of academic medical centers, hospital support to the institution. And so we do okay. But I've always said, you've heard me say this, if I had a $100 million check in my drawer and we could afford it, I'd give it to the Brody School of Medicine because they have been underfunded historically. The data is very clear. And so I just don't buy the narrative, right?
You know what happened to the last guy that said we were underfunded?
I understand that. And, I have a contract. I work for a separate company. Yeah. And if they want to attack me, that's fine. But my perspective is, and we have the data, that, Brody School of Medicine has been underfunded for a long time. The faculty need to be paid more.
Yeah.
And then, somebody takes action and they throw some breadcrumbs out here to the east and they call it a bailout. Well, I don't call starving my kids when I throw them a loaf of bread a bailout.
Yeah.
And so I just think that the whole narrative has been it's placed to an agenda. It's not my agenda. My agenda is to work collaboratively. And I'm an ICU doctor. And if you don't deal with harsh facts, people die. And the fact of the matter is these cuts. That's what this means to us. And that anybody that understands how care is delivered in eastern North Carolina would add on, for whatever justification they're coming up with, that don't realize that that's going to mean lives, and that $35 million is on top of two historic events that have never happened before in North Carolina: Medicaid transformation and this new state health plan. Mm-hmm. So I don't know. There are legislators, and I just think that, they don't like it when I talk, but I don't understand those actions because it doesn't take into context the reality of the people we serve that have been left behind. You know, if you look at the data, this whole region was left behind. And 40 years ago, Brody School of Medicine and Pitt County and the leaders here created something for Eastern North Carolina, and it actually has just caught up. Mm-hmm. And the idea that we are going to hurt it when it's just caught up is wrong for the people of Eastern North Carolina.
Well, I tell you, it was, this thing was a fight from the beginning when Leo Jenkins came up with the idea and said that Eastern North Carolina deserved a school of medicine, deserved a world-class medical facility. And it seems like it never stops. But now, based on what you're saying and based on things that I know, again, Eastern North Carolina is getting the short end of the stick. And on top of that, there's a bigger picture. And to me, they should just come out and say, this is our plan, rather than doing it the way that they're doing it. I mean, why don't they say, here's our plan? Plan at Carolinas Regional didn't work. We've moved into Eastern North Carolina. Now we're ready to come in and try to make a move on Vidant. Just say it.
Well, we've asked that many times.
Yeah.
And our board has asked. We know there's a plan because you told us there's a plan.
Right.
And the analogy has been that you're building a house. We just like to know what rooms we're in and be part of having a say of what those rooms look like. And so, we just want to have a rational conversation. And I think that these actions taken this week are part of another chapter. This is not new activity, right? And it's a how do we control and dominate? Yeah. Versus, respect.
In fact, that word dominate is written somewhere, isn't it?
Yes, it is.
I'm sure we're going to learn more about that. Dr. Waldrum, you've been great to come in and talk about this, especially I know you got legal issues facing you. The budget will be voted on in the Senate this morning. The first budget, my understanding, is Don Davis, who we got a text from this morning, is going to put a amendment in to try to take this provision to strip Vidant of funding out. I've said this again, and for our Eastern North Carolina senators who are listening, we're watching who votes for this and who doesn't.
Well, we're clearly watching, and we appreciate the support of our legislators that have taken the time to really study and learn and be moderate and not try to damage us as we try to work through this. That really doesn't make sense to us. You can go to Stand Up ENC and learn how to contact your legislators to have your voice heard, and you'll get information back that actually shows that they've been given a false narrative. And so we really think that the process that we've agreed to with the UNC system needs to be followed, and to say that we did this to pull away is a false narrative, and all of that. The truth will come out, and over time. And we would hope that everyone would want to support Eastern North Carolina while we work through these issues. And the idea of hurting us because 100% of our boards and 100% of the Pitt County commissioners studied this and knew what they were doing and did it for legitimate reasons. And you want to talk about respect for governance. You want to talk about respect for process. Well, where's the respect for our county commissioners and for our governance and the leaders that they are, because they're good people that made informed decisions for the right reasons for Eastern North Carolina.
Thank you, sir.
Thank you.
Good to see you. Mike Waldrum, CEO of Vidant Health. Appreciate Mike being here this morning, and obviously we'll continue to follow this. And